Hi, welcome back for another episode. My name is Dr. Sam Dar. I'm an orthodontist practicing in Canada and an early adopter of the Invisalign technique. Today I wanted to discuss what would happen when you're ready to start your treatment with Invisalign. So what's a process? That process may vary from one practice to the next, from one orthodontic office to the next, but generally speaking, the approach is more or less the same. So after having a consultation, you'll have a discussion with the orthodontist and you'll decide on a treatment plan, on an approach, or what needs to be done, what the treatment goals are. And once you decide on treatment, the first step is to take records. So basically what we do is we take photographs, just regular photographs, what we call intraoral photos, pictures inside the mouth, and extraoral photos, pictures basically, pictures of your face, smile, and profile. Because as we analyze the case, we want to make sure the teeth fit the smile, and that's why we ask you to smile, and we take a static photo of that. The second step usually is to take an x-ray. We also want to make sure that all the roots are healthy, the bone is healthy, and there's no issues, there's no impacted teeth. In other words, there's no teeth that are sort of hidden underneath the roots of the teeth that you have in your mouth right now. The third one is to take records, take impressions. And impressions can be either digital with a scanner or old-fashioned gooey impression like alginate or polyvinyl siloxane. Most of us remember having impressions taken for different reasons at a dental office. But nowadays, there's a better approach. There's a more recent, more accurate approach actually, which is called a scanner. And Invisalign has its own scanner. It's called the iTero scanner. Now, and this is the iTero scanner right next to me, and this is a patient that's already been scanned. Now, the new scanner is called the Element, and this is, it's an interactive scan. Once the scan is done, we can manipulate it, we can look at it from every angle, we can even look at the lower teeth by themselves. We can evaluate, check, see what else we need to do. You can look at the upper teeth now separately. So we can really manipulate it in 3D. It's a touch screen, as you notice, and then we can look at the bite, look at it from every angle, and manipulate it. Once we like it, once we analyze it, then we send that same scan to Align Technology, the company that makes Invisalign. And what they will do is they will take this same scan and incorporate it into a three-dimensional model, a software that is known as ClinCheck. Now, once we have the ClinCheck available in front of us as an orthodontist, I'm the one that moves your teeth. There's a misconception out there that the computer actually straightens your teeth, which couldn't be further from the truth. Your orthodontist should be manipulating the teeth and coming up with a treatment plan for you. So Invisalign provides us with the scan, provides us with the software, but we, as your treating doctor, will actually decide how to move your teeth, which teeth to move first, what's the sequence of movement and what have you, what the end result should be. So we actually use a ClinCheck to straighten your teeth. We give instructions, and based on that movement, Invisalign or Align Technology will actually make the aligners for you. They'll send them to us, they'll be numbered, there'll be a series of aligners. So the first step, just to summarize, will be to take photos. Sometimes we take x-rays at the same time, and we'll take a digital scan with the iTero scanner. Once everything is set, we email everything to Align Technology, or we submit it to their main server, and then a day or two later we get back a ClinCheck software, which is a digital animation of your teeth, and at that point we'll straighten your teeth. Once we're done, that usually takes a couple of back and forth, maybe a couple of days. Then we'll approve it, we'll send it back to Align Technology approved, and then it will take about 3 weeks or so to actually fabricate the aligners. So it's a custom-made appliance, and the aligners are made for you. And when we get them back 3 weeks later, that's when we'll explain to you, we'll get you back into the chair, we'll explain to you how it works, we'll give you instructions on how to clean them, how to wear them, what to expect at every visit, and from there on you just go through your treatment, 6, 9, 12, 18 months, whatever the treatment time is estimated as. So it's very painless. It's pretty straightforward. It's not nearly as time consuming as it used to be in the past. And if you have any questions, just remember, The last thing you want to do is sometimes go on Google and get some answers, because not all the answers out there are accurate. People mean well, they want to share their opinions sometimes, but sometimes they pick up on mistakes and then they just misinterpret them or misunderstand them and give the wrong advice. So the best thing to do is to reach out directly to your orthodontist and ask those clinical questions directly. You get a better answer. You get a more scientific answer. Hope you enjoy it. See you next time. Cheers.